There you go. Are we good, Bridget?
Now you're in. Yep.
Awesome. Okay, all right. Well,
Thanks for taking that.
Joining us in person and those that are at home as well. My name is Valeria. I'm one of the social workers at the Caregiver Support Center here.
And my name is Samantha Cornell, and I'm also a social worker and care manager in the Caregiver Support Center. And she and I both co-facilitate and facilitate some of the support groups here. So we are happy that you all joined us today. Before we jump into Dr. Kravitz's presentation, we wanted to make you aware of a program that we are starting on Wednesday, October 29th. It's going to run for 4 weeks, and it's meant to dovetail really nicely with this presentation. It's going to be an education and support group for people experiencing changes in memory and cognition. We're going to be offering it in person and also via Zoom. So the one in person is starting on October 29th and runs through November 19th. So it's 4 Wednesdays from 8:30 to 12. And I think it's going to be an extension and more detail of a lot of what you learned today from this presentation. So if you have any questions, feel free to ask either one of us. And there are also some flyers in the back.
And for those at home, all the slides will be sent to you guys afterwards. And we also will be sending the flyer for the workshop series as well. Any questions, feel free to type them in the chat. There's someone monitoring it. And at the end, if we have questions, she'll come up and share the questions for Dr. Kravitz. And to segue into her introduction, Dr. Jena Kravitz is a licensed clinical psychologist in California. Her clinical focus is in the areas of adult and geriatric neuropsychological and psychological assessment, memory, and executive coaching and cognitive rehabilitation for teens, adults, and older adults. Dr. Kravitz received her doctoral degree from Pepperdine University in 2006. She further specialized her practice completing postdoctoral training in geriatric neuropsychology at the UCLA Longevity Center. She has an extensive resume of experiences, and we're so honored to have her present to us today.
Thank you. Oh, you don't have to clap for me. All right. So first of all, thank you for coming. I know the weather wasn't ideal today. It's a little rainy here in Los Angeles. I want to say a quick hello to my mom, who is watching in Las Vegas today, where she lives, and to my bonus mom, my mother-in-law, who also I'm very close with, who is watching too. So from outside of here. So I promised I would say hi. So thank you all for coming. First, I want to start by telling you a little bit about myself. I have a big voice because I'm also a mom. And so I've got a big voice and I work in geriatrics. So those things combined will give you a pretty loud voice. So let's go to the next slide. So I'll tell you a little bit about me. I would tell you about me, but first I have to see the slide to know about me. So like Valeria mentioned, I have a long history. This is my 21st year as a clinician, a licensed clinician. I started my training at UCLA. I'm an LA native. So I started my training at UCLA, went on to study neurorehabilitation at NYU in my clinical residency years, came back to LA to focus my studies and my fellowship on geriatric neuropsychology at UCLA, then stayed on staff for 20 years at the UCLA Aging and Memory Research Center. And some of what we're going to talk about will be some of that. I was very proud to be one of the researchers involved in the UCLA Brain Boot Camp program, which was one of the first memory enhancement programs in the country that was founded in evidence-based research. I spent the next 8 years at Cedars-Sinai Medical Center as a hospitalist neuropsychologist. So I saw people in the hospital straight from the ER, post-stroke, post-head injury, post-heart attacks, things like that, and just saw them while they were in the hospital. And then a few years ago, I expanded. I left the city because I live in the Calabasas area and decided I was done doing the drive. I left UCLA and Cedars-Sinai in 2022, or Cedars a little before that. And I went into private practice, which was never something that I was planning on doing, but has been a wonderful experience. So my specialty is in geriatrics. It is the population I enjoy working with the most. I have a specialty in evaluating for different types of dementias, different understandings of severities. That's really what I'm passionate about. And then secondarily, doing some memory enhancement, cognitive remediation. But outside of my professional life is my most important job. I am a single mom of 16-year-old boy-girl twins. And we just started the college process. And it is a process, let me tell you. Both my kids just started driving a couple of months ago, which has made my life so different and so much better, but so much more anxious. So with that, I know I'm going to walk out of the screen there for a second, but I'm just grabbing some notes because I want to make sure. Have you ever walked into a room and forgotten why? Okay, guys, I'm 46 and I do that too. Okay. Do you need something? No?
No, I'm 45 and I do that.
Oh, yeah. Yes, I am 46 and I do that. The thing is, we all experience memory lapses. It's a part of being human. Okay. But it doesn't always mean that we're developing dementia when we have memory lapses. So today, we're going to explore the continuum from normal aging and what is normal to what is not normal and how to stay ahead of that based on what we know from the research. Now, just to give you a sense, here's some data on what the population looks like. By the year 2030, we are going to have a large number, almost 75 million older adults. I'm going to have a job for a long time. Okay. 50% of individuals over the age of 65 complain about some type of cognitive deficit. It's not always memory, it could be other things, right? Visual spatial issues. But a vast majority are concerned about having early signs and symptoms of Alzheimer's disease. Researchers tell you that one new case of dementia is detected every 4 seconds globally. And by the year 2050, more than 115 million people will have dementia worldwide. On top of that, our 85 plus group, is anyone in that group here? You are the fastest growing population that we have. So I'm so happy to have you here. Okay, so let's talk a little bit about what is normal and what is not normal. Okay, now some of these might be a little bit of an exaggeration, but you get the point here. Forgetting where you left your checkbook, if you still use a checkbook. My kids have no idea what a checkbook is. Okay, or a payphone for that matter. Forgetting where you left your checkbook, forgetting where you left something, totally normal. Oftentimes we do things without paying too much attention. So oftentimes we have an attention issue and not a memory problem. Forgetting where you bank, however, that is not normal. Okay, forgetting what you ate for dinner yesterday, normal. Forgetting that you ate 15 minutes ago, not normal. Getting lost in a new city, totally normal. I do it. I've lived here my whole life and I still get lost in certain places. But getting lost on your way home from the grocery store, not normal. Forgetting where you parked in a shopping mall, totally normal. Yeah, I've done that too. Forgetting you drove to the mall or even have a car, or if you forgot where you parked in your apartment complex, your driveway, not normal. Okay, so you get the difference between normal and not normal aging. All right, so I figured I would talk a little bit about, brain functions and aging. Okay, so I'm a neuropsychologist. Neuropsychologists are people who are clinical psychologists with additional years of training in neuropsychology. Okay, so neuroanatomy and all sorts of understandings of the brain functions. And for me, the brain as we get older. So brain functions that decline with aging in general, a little bit slower to process information. Maybe you don't think as fast as you used to. Executive functions. So executive functions are mediated by the very front part of our brain called the frontal lobes. Things like decision-making, reasoning, judgment, verbal and nonverbal reasoning, nonverbal puzzles, okay? Things like that, problem solving. I had once a patient who was 80, and he told me, I met him at NYU. He was a CEO, a very well-known CEO of a big company, and he was in the hospital because he decided to prune his trees. And it was like November and cold and windy. So he got up on his ladder and decided to prune his trees. Now, did I need to give him a test to see if his decision-making was good or not? No, because that probably wasn't a good decision, right? And that's what I mean by executive functions, doing things that may not be the safest for you, thinking you can do them. Occasional word finding problems. Oh my gosh, every single person has a word finding problem. Most people that starts at age 30, okay? And it gets about 10% worse per decade, sorry. But word finding problems, memory. And it's not that you can't learn new things, it's that you can't pull them out. And we call that retrieval, okay? Learning someone's name and being able to retrieve it, right? So that's what we're talking about. Now, importantly, your ability to pay attention, your vocabulary, these are things that don't change with an aging brain, okay? Now, of course, there are some caveats to that. You have someone with an attention deficit disorder, maybe that would get worse, or poor executive functions. But vocabulary is one of those things that doesn't change. And in fact, when I meet someone in the office, one of the problems with what I do is that I didn't know someone before they come in. I only meet them when something is wrong. So I have no basis for comparison, but we have tests that help us to estimate what someone's baseline was like when they were 30. And that test is a vocabulary test because that can help us determine kind of where someone was at their peak. Okay. Now, one of the things that happens as we go to older is our brain shrinks a little bit. Right? Our brain tends to shrink a little bit. And when it shrinks, it means that our synapses work less effectively and efficiently. It means that some of our neurons die off. If you've had a stroke or a bleed in your brain, the tissue in that area is dead. The neurons die. And plaques and tangles can accumulate in your brain. So what really happens with aging is that it's really efficiency changes and not ability changes, okay? Efficiency changes, but not ability changes. Many of our abilities stay the same or even improve as we get older because of wisdom, right? Until they don't. Okay, so reasons for concern. Now, I gave you guys an image here so you can see, and I have some pretty cool images to share. So this is an image that shows you a healthy brain versus an Alzheimer's disease brain. And you can see that the ventricles here in the middle are much larger on an Alzheimer's brain, that those areas right there versus these more tighter areas. There's also a lot more space in between the little wiggles, okay? But yes?
Seth, the larger ventricles there on the right, is
Yes,
that due to
that's
diminished?
Alzheimer's
flow?
disease.
That's,
It can be, yeah. Okay. So the question was, what causes that? And Alzheimer's disease will cause that for a multitude of reasons, including less blood flow, more plaques and tangles. So the structure changes a little bit. Okay. So let me go on. You can ask questions at the end. Okay. So I see a lot of people who come to me and say, I keep losing my glasses and my keys. I think I'm getting Alzheimer's disease. That is not a reason for concern. I lose my keys and glasses. I'm certainly concerned about Alzheimer's disease, but not today. I lose my keys and glasses because I'm doing other things while I'm putting them down. And so are you. Okay. Reasons for concern would be memory loss that affects your daily life. Okay. Memory loss that really affects your daily life. Getting lost in familiar places, that becomes unsafe, right? Difficulty managing your bills. When you need someone to help you manage your bills, or you make mistakes, you overpay, you underpay, you just forget to pay, okay? Difficulty managing your medications. Older adults on average take 12 medications a day.
12.
12.
I
That's the average, okay? So it's not unheard of to need help with that. Hold on, I gotta finish, okay? Poor decision making, like my friend who decided to prune his trees at 80 plus years old in the cold, windy, rainy day. Language changes. That would be another one. There's a difference between not being able to find a word and not being able to get your point across. Okay, so language changes. Personality changes. You might become more disinhibited, okay, more impulsive. Things like that. Those are reasons to worry. Changes in your independence. This is big, okay, because the actual definition and the diagnosis of dementia requires a change in your functional level of independence, okay? So the minute you can't do things for yourself, then you transition over into the range of dementia. And of course, safety concerns. All of those would be reasons for concern. All right, so let's back up and we're going to talk about what is memory. And just bear with me because some of this might be not as exciting for you. All right, here we go. What is memory? All right, so it is a process of learning new information. Can you learn something new? Okay, and I'm going to show you a visual next, but for now, it requires encoding. So you have an encoding, which is like learning the incoming information. Then you move into a process called consolidation and storage, where your brain actually decides, is this important enough to store? Where do I store this so I can later retrieve it? Or is it gone? That doesn't matter, okay? And then you have the last part, which is retrieval. So retrieving the information after you've learned it. Okay, and there's two ways to test retrieval: recall and recognition. So spontaneous recall would be something like, oh, I wasn't even there yet, but that's okay, that's okay. So spontaneous recall would be something like a short answer essay test, where you have to, you remember those tests where you had to write an essay? Right? Short answer, essays, that's spontaneous recall. A recognition test is a multiple choice test. Can you recognize the right answer amongst a set of distractors? And we evaluate both as neuropsychologists. Why? Because I want to know if your brain is capable of learning information, okay? So if I gave you a story to learn and I said, hey, and then 20 minutes later, I said, hey, can you tell me everything about that story I read you? And you said, what story? Okay. I said, okay, so you don't remember it spontaneously. That's okay. Can you tell me, was the woman's name Diana Thompson? Oh, yes, it was. Did the story take place in Chicago? No, I think you said San Francisco. I did. Now, why is that important? Because if you can't spontaneously retrieve, but you can recognize the right answer, it means that your brain learned it. It encoded it. And that is key when evaluating for things like Alzheimer's disease, because people with Alzheimer's disease have a very hard time learning new information. So even on a recognition test, they would not get the answer right. Next. All right, so let's look at the various types of memory here. Okay, so we have our sensory memory. This is like a big satellite, okay? It's like a big satellite, and it's taking in using all of your senses to pick up information. We call this your sensory memory, okay? No real effect on aging here, right? Now, have you ever walked by someone in the mall and they have a cologne that smells like your 7th grade boyfriend?
No.
I do, right? That one of the ways that we encode information is through our senses. And that's why when you walk by somebody wearing Drakkar, you think to yourself, oh, I remember in 1991, for me, that boy I liked. Okay, sensory memory. Primary memory is very short term, and it is your ability to remember 5 to 7 pieces of information, like a phone number. Okay, remember when you used to call 411 for a phone number, but you didn't have a pen and paper, so you had to remember it for 5 seconds and then hang up and redial? That is your primary memory at work. Okay, we call that a working memory too. And again, it doesn't really have any impact on aging. Okay, that's not an area that necessarily gets worse. Okay, then we have our secondary memory. And this is really your learning and your storage system. And this is the most vulnerable to aging. Okay, this is your secondary memory. And then we have our tertiary memory, which is our long-term memory, which is like a vault, okay? If you are 100 years old, you should still be able to tell me the make and model of your first car. Some people can even tell me the phone number they had growing up. I can. The address, the name of the street you grew up on, those things don't go away. They are in a long-term memory. So when I get someone who comes to my office and says, I can't remember things from my childhood, we are not really looking at a classic Alzheimer's disease. That usually is more psychiatric, brain injury, stroke, right? Things that will affect that vault. But that is not something that aging should impact. Okay, so just to give you a visual, okay, here's the way that learning and memory works. Okay, you learn, you encode this way, then your brain decides, how am I storing this? And so it's in this holding zone, right? That's that primary memory, 5 to 7 chunks of information. Then your brain decides, how am I storing this? And it can go, into however it chooses to store it, long-term, short-term memory. Now, recall requires you to retrieve that information and pull it through short-term, immediate, and back to your original sensory memory. Okay? So that's sort of just so when we're looking at forgetfulness, we're looking at memory problems, we're looking at that type of diagram to see where in that process are the problems. Okay, because where the problems are tell us what the diagnosis is, to be very honest. Okay, so we have a few reasons for forgetfulness. One of them would be poor retrieval. So when you meet someone new, you might be quick to forget their name, right? So when I meet someone new or when I teach a class, I always tell someone a story about myself, because if I can help them to encode my name, then they will remember it better. Okay, so here's my fun fact, and then after you can think of your own fun fact, and later when you guys introduce yourselves maybe to each other, you can introduce yourself with your fun fact. So when I was born, my poor mother was in labor for 40 hours. They don't let you do that anymore. But back then, she was delirious and she was in labor for a long time. And she said to my father, who was in English as a second language, he's from Israel, she said, David, I'm going to choose the first name and you can choose whatever middle name you want. And my dad chose the name Talia. And so my name was Jena Talia. It's true. It's a true story. Thankfully.
Between Jena and.
Yeah, well, I have a different middle name now, thankfully. Okay. But I've had people who have come to see me speak say, I saw you 5 years ago and I never forgot your name. So when you introduce yourself to someone, you want to give them an encoding cue. That is what that is. It helps you to learn. It's like learning an acronym for learning, or a song for learning the states in the United States. That's how our kids are learning in school these days. Okay, so poor retrieval cues are one reason. Poor attention. If you're not paying attention to something, you cannot learn it. Our kids with ADHD don't have a memory problem. They have an attention problem, which prevents them from being able to encode information. Okay? Interference. If you had 2 tests on the same day, that you have too much going on. Okay? Another reason, something like Alzheimer's disease. And lastly, psychological issues, psychiatric. Okay, you went through a lot of trauma, you repress things. Okay, that can cause forgetfulness also. Okay. All right. Now, we live now in a world where we have a continuum of memory disorders. Now, it used to be back when my grandparents were alive, right? And I had a grandparent with Alzheimer's disease, that you were either normal or dementia, right? And if you had dementia, you were just Alzheimer's disease. That's what everyone thought. But that's not the case anymore, okay? We have a continuum now of different diagnoses, different severities, right? So normal aging is a normal brain function for your age. When you go see a neuropsychologist, they're testing you and they're comparing your scores to other people your age with your education level to really look at apples to apples, okay? That's what we do. We run statistics. Now, a subjective cognitive decline is your report of your memory changing, okay? When that happens, you might have one area that is a little bit worse than it used to be, okay? Maybe say memory, but everything else looks pretty intact. We call that mild cognitive impairment, okay? Nowadays, mild neurocognitive disorder. Because you might have this like one memory problem or a visual spatial problem, but you're pretty independent, okay? So, you don't need help with many things. That's considered MCI, mild cognitive impairment. And then you could potentially progress to dementia, okay? But dementia is an umbrella term. And under the umbrella of dementia, we have Alzheimer's disease, which is one type of dementia. We have frontotemporal dementia. We have vascular dementia. We have Korsakoff syndrome. You get the point. We have a lot of different kinds of dementias. And so one of the things that I do is spend my days figuring out which kind does my patient have so I can help the neurologist to pick the right treatment, right? Now, MCI is a special one. It's a special type of label because MCI can be broken down into amnestic and non-amnestic, the forgetful and the not so forgetful kinds. So maybe you have a problem with problem solving, reasoning, poor attention, and your visual spatial functions are not so great, but your memory is pretty good. That would be a non-amnestic type of MCI. But if you have an MCI where memory is the main problem, we call that amnestic MCI. And about 90% of those people will go on to convert to Alzheimer's disease, okay? Some cases, though, we have found in the last 20 years through our research on cognitive training, which is why these women are having this memory course for you, because there is research now that tells us that some cases of MCI will actually improve. All right.
Why is that?
Well, we'll talk about that in a minute, okay? So dementia is not normal aging. I have heard one too many older adults say to me, my memory is just as bad as everybody else my age, okay? Dementia is not normal aging. Dementia is an impairment in memory and at least one other cognitive function that impacts your ability to be independent. Okay, so once you see the deficits become severe enough to interfere with carrying out your daily activities, paying your bills, managing your medications, shopping on your own, driving, getting in and out of bed, feeding yourself, bathing yourself, grooming yourself, using the restroom by yourself. Okay, these are just examples. Then you cross from MCI into dementia, and that is not normal. Okay, I swear, another person who says to me, my memory is just as bad as everyone else my age. I'm like, yeah, no. So the neuropsych testing, things like what I do, help to determine if someone's cognitive functions are normal for their age and can help differentiate what kind of dementia may be brewing underneath the surface so we can get you started on some treatment. Okay. So just so we're clear, dementia is not normal aging. Now, I wanted to show you this. I didn't give you this in your slide deck because this actually was given to me courtesy of some friends at UCLA, and I didn't have permission to share that with you all, but I have permission to share it here on the screen. I wanted to show you something. So oftentimes when you go to a neurologist, they will order you an MRI or a PET scan. Okay. Now, MRIs are not the best option for us when we're trying to look at dementia and if someone has it. And the reason is because it looks a whole lot like a regular scan, right? So I know some of you may not know what a normal scan looks like. I probably should have put that up there, but it looks pretty normal, okay? MRIs can check the function of your brain, not the structure. PET scans are newer in the last 20, 25 years. A PET scan measures the glucose metabolism in your brain, okay? So the hot colors are good and the cool colors are not good. So what you have here is a normal older adult brain versus someone with Alzheimer's disease. Now, these are the temporal and parietal lobes, okay? And those areas are not working as well. There's not enough red, hot colors in those areas, which tells us that the brain is not metabolizing glucose as well as their friend. Now, next slide. Okay, so on the next one, you'll see normal, early Alzheimer's disease, late Alzheimer's disease. Okay, now, the very end, you'll see the PET scan of a toddler. What do you notice? The toddler brain looks a whole lot, right? So if you wouldn't ask your toddler to pay his own bills, why would you ever ask someone with Alzheimer's disease to do that? You're looking at nearly the same capabilities. And that is why a PET scan is so helpful for us. Problems with PET scans is they're very expensive and oftentimes insurance doesn't cover them unless they feel there's a big need to. So your neurologist has to make, that call and really push for it. Okay. So I just wanted to show you guys that. Go ahead. Up to 45% of dementia risk is potentially preventable. You heard that right. Preventable through lifestyle and health management for people my age. Hold on, I got to wait till the end for the questions. I'm sorry, because I have to get through it, okay? So the most important thing that I want you to take away from today, all of you, whether you're here live or you're here on Zoom, is that while we can't control everything that affects memory, almost half of the risk of developing dementia is within our control. Now, I am somebody who has a very high likelihood of being a genetic carrier for Alzheimer's disease. My grandfather had it. My mother was tested positive in her genetics. And so I assume that I too have a genetic risk of developing Alzheimer's disease. Genetic risks don't always mean that you end up developing it, though. It means that you're at risk for it. You have a higher chance, but it's not always that you will, okay? Now, the Lancet, I'm sorry, can you go back for a sec? Sorry, the Lancet Commission is essentially a global task force of dementia researchers and clinicians who got together and they review all of the data in the world that's published every few years to see what is actually supported by evidence from research, okay? Now, their most recent update was in 2024. And that update is what told us that 45% of dementia risk could be prevented or delayed by addressing just 14 lifestyle factors.
What?
Well, there's a lot of things you can control. And this, I should say, is one of the most respected peer-reviewed sources in our field, and it gives us a framework to understand prevention. Okay, so let's look at that. Sorry, I didn't mean to keep you going back and forth there. Poor Valeria. So one of the reasons that our brains can potentially improve, and to answer your question, sir, is because of neuroplasticity, okay? Our brains are plastic. You know, you have to think of your brain as a muscle, right? Like building muscle. You know, you may not stop aging, but you can slow it down, you can stay strong, okay? The brain is not a muscle, just to clarify, but you have to think of it like that, right? If you go to the gym and you work on your muscles, then you're gonna have bigger muscles, stronger muscles, okay? If you don't do anything with your brain, it's going to waste away, okay? So the brain is capable of forming new connections, okay? Sometimes like somebody who has a stroke, right? It's like driving on a freeway that has 5 lanes and it's wide open. But then someone has a stroke. So then those 5 lanes might get down to 2 lanes. So it's a little slower, but the messages still get there, right? And so it can form new connections. It can find detours around the construction zones, if you will, okay? Activities that challenge your thinking, your coordination, your creativity are what is important as we get older. Even in mild cognitive decline, and this is important because this was the biggest part of research that come out in the last 20 years, 25 years, is that even in mild cognitive decline, targeted interventions, actual training can preserve or even improve functions even in people with mild cognitive impairment. Okay, targeted. So I think these women are going to have this memory course here, and they're going to do some of those types of targeted interventions. Now, what are the modifiable risk factors? There we are. Now, which do you think is the number one most, the number one risk factor in this list? Anyone?
Physical inactivity.
Okay, physical inactivity.
Social isolation.
It is hearing loss. Okay? Hearing loss doesn't just affect your ears. Okay? It affects your brain. So this is one of the biggest risk factors in aging. When sounds are muffled, your brain has to work overtime to fill in the gaps, right, from the muffling. And that pulls resources away from attention and memory and, executive functions. And over time, that extra workload that your brain has, combined with isolation, maybe less stimulation, can actually accelerate your brain's age. Okay. The good news here is that treating hearing loss changes that entire trajectory. So I've had so many patients that come to me and the problem is hearing, and I test them and it looks like they have dementia, but a year later they come back and they've had hearing aids and they look totally normal. Okay. So before you go see your doctor, get your hearing checked. You're going to save yourself a lot of heartache and the doctor's time. But some of the other modifiable risk factors here, and guys, I will be clear that these are things that should have been addressed back in your 40s and 50s. Okay, if you tell me now I'm going to start working out tomorrow, that's great. But the truth is that people my age should really be concerned about this, right? Things like hypertension, diabetes, not, being physically active, obesity, smoking, alcohol misuse, depression. Depression in older adults actually changes your brain's neurotransmitters' ability to communicate with each other. So depression in older adults can look like dementia, which is curable with an antidepressant. Sleep disturbance, social isolation, lower education, air pollution, traumatic brain injury, and a high LDL cholesterol. Okay. Now, go ahead. There are 3 studies that you should know about. One of them is the ACHIEVE trial. Okay. And this was done with 1,000 plus older adults with untreated hearing loss. This is how we get this data, right? After 3 years, those who got hearing aids and care had 48% slower cognitive decline than the controls, okay? So this just shows you that hearing aids aren't just about hearing. They are brain protection devices, okay? So don't be afraid to get those, okay? The next one is the Sprint Mind study. This was another study, and these are all done with large groups of people, but this studied blood pressure and the risk for developing mild cognitive impairment. And basically what came out of this is that every heartbeat feeds your brain. So you want to take care of your heart, okay? Because that was a big one. And the last one is the finger trial, okay? And this was Finland. Just want to make sure I'm good on time here. Finland. Okay, so this one was about diet, exercise, lifestyle factors, okay? And the take-home message from this particular trial was that there's no magic pill. I wish there was. I would take it, okay? But when you combine small changes, the brain will thank you in very big ways, okay? And so these were key in determining what we can do to avoid cognitive decline as we get older. Okay, so one of those things is called the MIND diet. Some of you may have heard it called the DASH diet. And this is all about eating for your neurons, and what's good for your heart is often good for your brain. So this is a high focus on Mediterranean diet, high polyphenols, leafy greens, berries, olive oils, and people who were on this diet in large studies were found to have slower cognitive decline and lower Alzheimer's risk. Okay, now there was a study at Rush University. You can keep it on. You're good, yeah. And Harvard. Okay, so this diet came out of Rush University and Harvard. Okay, three obviously big name institutions with over 600 participants in their study, and they found a 53% lower rate of Alzheimer's disease for those with the highest MIND diet scores, the people who stuck with it the best, who ate those types of foods. Even the participants who maybe didn't stick with it completely, we call them the moderate scores, showed a 35% lower rate compared with the people who had the lowest adherence to the diet. Now, the results didn't change after adjusting for factors associated with dementia, like healthy lifestyle behaviors, exercise, things like that. And so basically the conclusion here was that the MIND diet was associated with preserving cognitive functions, even when they took into consideration high blood pressure, high cholesterol, diabetes, obesity, things like that. Okay, so this was very exciting for us as clinicians, because when I give someone bad news, like on my testing, it looks like you have Alzheimer's disease or you're really at risk for it, I always tell my patients, let's focus on the things we can control. Because if you already have Alzheimer's disease, we can't control that, okay? It's already there. But we can control at least 14 other factors that may slow it down, okay? One of the things I like to tell my older adults is to learn something new. Guys, I cannot stress this enough. Now think about this. How many times a day do you have to think about how to do something for the first time? You get in your car, you know how to drive, you don't have to think about it. Maybe you make coffee in the morning. You probably don't have to learn how to do that. You've been doing that for a long time. Maybe you make something at home, or, log in to the internet or your email. You don't have to learn how to do that. As we get older, we are learning less and less. Think about it, kids are at school all day. Their hippocampus, which is in charge of new learning, is constantly at work. As we get older, our hippocampus doesn't get a lot of love because we don't do a lot of things that require us to learn something new, okay? People who do puzzles and, word searches, it's great. It's cognitive stimulation, but the real key is learning how to do something new. So my father-in-law, for example, bought a book some years ago called Bridge for Dummies. and he's 82, I think now. Don't kill me if I'm wrong. 82, and he learned how to play bridge, and then he taught himself with a book, and then he joined a men's group to play bridge every week. That is probably one of the best things he could have done to protect his brain. Cooking a new recipe. A new recipe is a cognitive activity. It requires planning, organization, measuring, paying attention, things like that. So even cooking a new recipe is great. Okay. So if you also get bonus points if you do something out of your comfort zone. I had a patient, a male, who told me that I saw him a year and then I saw him 2 years later, and he learned how to knit, which was totally out of his comfort zone. He's an engineer, but what a great cognitive challenge for him to do that. Okay. So what do we know? Now, I will say that I started in this field a long time ago, back in 2001. And in my day, this was one of the most exciting research developments out there. It was published by a neurologist by the name of Gary Small, who I had the great pleasure of working for almost 20 years at UCLA. And I'm happy to say that I was a doctoral student on this particular project. But this was one of the very first pieces of research that we had that studied significant cognitive change and led to a program at UCLA called Brain Boot Camp. Okay. So 14 days, we took a group of people and we said, for 14 days, we're going to have you do these things, these lifestyle changes. Okay. Now, what came out of that? On imaging, okay, when we put them through MRIs and PET scans, there was better, the areas that mediate working memory, less anxiety, okay, those areas of the brain were working better. Okay. On imaging, remember when I showed you the hot colors versus the cold colors? 5% more hot colors. After 14 days, I've got to wait. Okay. Greater cognitive efficacy, meaning people were doing the same tasks with less work. Their brain wasn't working as hard to do the same things. Okay. Improved verbal fluency. And basically, in 14 days, this impacted overall brain health. And since 2006, there have been numerous studies published that came after this one on the positive effects of cognitive training for older adults. Okay, so much like if you got injured, you would go to a physical therapist, right? Nowadays, you can go to a cognitive therapist. You can go to memory classes. These types of cognitive training, targeted cognitive training exercises, have now been proven, just like physical therapy, to improve your brain functions. Okay. Now, there's group versus individual cognitive training. And I will say that over 2,800 people, so there was a 10-year follow-up to this study, okay, found after 10 years lasting gains in reasoning and processing speed. So after 10 years of implementing the diet, the exercise, the cognitive exercises, the lifestyle changes, better sleep, better hearing, right? That there was gains for over 10 years. Now, those people who had the gains over 10 years either were consistent or they had booster sessions, right? To get in there and just every couple of years go through the lifestyle changes again to make sure that they were sticking with it. Okay. All right. We can go to the next one. Do you?
Michael Phelps that was mentioned at the end here, is he the swimmer that?
No. It's just a researcher at UCLA.
Okay.
Okay. Now, health coaching. So before I actually knew about this memory course you guys are doing, I will say that I refer a lot of people to Pacific Neuroscience Institute. It's in Santa Monica. And basically, here's the story behind it. So I was on staff at UCLA for a long time. And in 2022-ish, 2021, Pacific Neuroscience came about and they came to our department and said, we want you all to come here because we want to take all this amazing research you're doing and we want to make it into programs for the older adult community. Okay, now it's not covered by insurance, but these are just, memory classes and things like that based on your research. So at that time, I went into private practice. I said, I cannot drive all the way to Santa Monica because I have kids that didn't drive yet. But most of my colleagues, who happen to be some of the best memory researchers in the world, went and created health coaching and continued to do research at UCLA. Okay, and so one of the things they've found is that this health coaching, so all aspects, right, from diet, lifestyle, sleep factors, overall health, hearing, across neurological and general medical populations, including early MS and Alzheimer's disease, benefited from this. Even remote coaching, so if you could do some Zoom stuff or be online with people, enhanced your own self-management, and was pretty well received and scalable. And the interventions that they focused on included personalized diet, exercise, lifestyle guidance, and they have their own research team who does that. So, for example, they have a program called Vital Minds. They have a program called Fit Brain. There's different programs for different people with different types of memory disorders, and they've been really active in providing those types of courses to the community. Now, of course, if you live in this area, why would you go all the way to Santa Monica when you have these wonderful ladies who are essentially using the research, I assume, to create memory programs for you? The take-home message is to know that they help, that these are not just to keep you busy. Nobody feels bad for you, and that's why they're creating programs. They're creating programs because in this day and age, we know from research that they work. Okay? All right. So how to stay ahead? So we've talked about the modifiable risk factors, right? We've talked about some of the new research that's come out. So first and foremost, move your body a little bit, okay? Even if you're chair bound, you can do chair exercises, okay? Exercise increases blood flow and growth factors. Connect. Older adults tend to be a little bit more socially isolated. You don't have a job to go to every day anymore, okay? It's not as easy to stay social, but social ties prevent depression and they prevent isolation, and isolation is a risk factor, and so is depression, to cognitive decline, okay? Challenge, learn something new, okay? That's like the one thing I can't focus on enough. Cognitive stimulation helps build new neural pathways. So learn something new and rest. Sleep is really where your brain takes the new information and consolidates it, okay? And so sleep is going to help with everything. And I know so many older adults who don't sleep as well as they used to.
No, you don't.
It's really important that if you don't sleep well, you talk to your doctor about it, okay? Because sleep is going to help your brain. So remember that if we're focusing on, it's okay, the 45% of preventable risks, that this is a short and sweet way to remember it, okay? Move, connect, challenge, rest. Those are the 4 things you can do to stay ahead. Now, I know some of you came here and you were hoping that I would give you some actual memory exercises. And I told Martha, who runs the program, I said, that's like a whole other hour of a training, okay? So for now, you've got these wonderful ladies who are going to provide that memory course for you. And then I'm happy to come back and do that. So let's look at our final slide, our takeaways here. We lost one. So our final takeaways, okay? Some memory changes are normal. You don't have to freak out if you're losing your keys, phone, or glasses, okay? Early detection matters. Early detection matters. There are multiple medications and phase 3 clinical trials that are available right here in Los Angeles for people who have been proven to have mild forms of Alzheimer's disease. But once you cross over into moderate, you are no longer eligible. Okay, so early detection matters. Your doctors can give you something that will slow the progression, but only if you're in the mild phases. And you can implement lifestyle factors and improvements that will help to slow down any progression, okay? Many risk factors are modifiable. That is up to you. Okay, we can give you the information, but what you do with it is on you. And of course, that your brain is adaptive and resilient. The goal here isn't just to live longer, it's to live sharper for longer. Yes, every step you take to protect your heart, your hearing, and your social life also protects your brain. So wake up every day and make decisions that'll help you live sharper for longer. Okay. I'm going to take a sip of water here. Yes.
Any correlation between length of being under anesthesia?
Oh, that's so tricky. Well, yeah, it's a tricky one. So I'm not as familiar with the anesthesia research because some studies will say, and here's what I know. Some studies will say yes, some studies will say no. But the truth is that many times older adults have a harder time coming out of anesthesia because those medications are putting your brain to sleep in certain places. And so in general, it is usually harder for older adults to come out of anesthesia. Now, whether there's a long-term risk, the other issue in studying that is how would we quantify that? You have to have spent X amount of hours under anesthesia for us to understand the long-term risk. So I don't have the answer for you. Yeah. Anyone else?
We do have some from the chat.
Oh, I'll try.
Do you have any books that you would recommend?
There are so many books out there. I'm a big fan of the Memory Bible, the Memory Prescription. Those are Gary Small. But there's been, those were published in the mid 2000s, and now there are even more of them. And to be honest, there are a lot of great websites and computer programs like Lumosity and Dakelished online. That's okay, online cognitive programs. Oof. I can't hear myself. Someone asked about meditation in the chat, and I will say meditation has been proven also to enhance cognitive functions. There was a very long study done at UCLA on the impact of Tai Chi, and with very promising results. And so I will say that meditation and Tai Chi for older adults has been proven in the research to help enhance your cognitive functions. There's also questions that I get often like turmeric or pomegranate juice, right? Things like that. And here's the thing. Here's an interesting fact for you. In India, there's a very low incidence of Alzheimer's disease. And so, of course, we started as researchers 20 years ago looking into this and going, how come they don't have Alzheimer's disease and we do? And so one of the things we came up with was that these people take a lot of turmeric and curcumin, right? Curry. And that is a natural anti-inflammatory. So, of course, we got a research study together and started giving people curcumin and turmeric, and there really wasn't a very good result. And so we started thinking, why? I mean, it seems to work for all these people in India. And the reason is because people who grew up in India or places where there's high anti-inflammatory diets have been exposed to those things since in utero. So, of course, when I had kids, I started giving my kids fish oil at like 4 years old. I'm giving them like curcumin gummies until they grew up and said, this is gross, I'm not taking it anymore. But the key is, yes, those things are very good for your brain. And the earlier you can take them in life, the more impactful they will be. So I'm not going to tell you to go out and take a gram of, turmeric these days. It won't hurt you. It's just that it hasn't been super proven to help you. And the pomegranate juice did have actually very significant results. So pomegranate juice on imaging actually showed this giant increase in your glucose metabolism. Here's the problem. Pomegranate juice is really high in sugar. And so if you're diabetic or pre-diabetic, you have to be really careful with pomegranate juice. And I would talk to your doctor about it. If you're thinking about it, you can take supplements, pomegranate supplements. But again, I don't want you to go out there and raise your blood sugar and come back and tell me, you told me. Okay. So what else? What other questions? I don't know.
We can take one more.
Oh,
How about the egg rolls and the pomegranate? If you eat them in a salad or,
I don't know. I'm not a dietitian, and I don't know how much sugars are in those versus other parts of it. Yeah. Wait, okay, I'll do one more because that didn't count.
Yeah, we'll do one.
Okay, yes.
I was wondering if you could talk a little bit more about what the connection between diabetes and brain health is.
Ooh, so this is really an interesting area right now. And I'm hesitant to even talk about this study, but there was a recent study that came out. And have you all heard of Ozempic and the GLP-1 drugs? Okay. So these medications are called GLP-1 medications. And so there was a theory a long time ago, before Alzheimer's disease was called Alzheimer's disease, that Alzheimer's disease was potentially a diabetes type 3. Okay. And so recently there was this study that came out that had shown, and this was an incidental finding, meaning it was an accident, that people on these GLP-1 medications had like a 30% less progression towards dementia. And so it was.
But you're gonna tell me it was bad.
No.
I lost weight, it was.
Yeah, no, it's, yeah. And so it was the very first medication that came out that people said this is potentially able to protect people from this. And if you think about Alzheimer's disease as potentially something that has to do with glucose metabolism, then it would make sense that if you're on those medications, that it lowers your risk. In general, diabetes increases your risk of Alzheimer's disease. And that's really an issue of being able to process sugars, right? So, and as you get older, there's a higher risk for that. And I will say this is my caveat. We don't have enough evidence today to suggest that GLP-1 medications will prevent everybody from getting Alzheimer's disease, right? This was just like a random incidental finding that people in my community are talking about. So now it's a matter of getting Eli Lilly, who makes the drug, into research with older adults who are at risk for Alzheimer's, so that we have a lot of work to do to say that it actually will work to prevent it. Right now, we don't have any medications that prevent Alzheimer's disease. We only have medications that help slow down the progression. Okay, and with that, I'm going to wrap it up. Thank you guys for logging in at home. Thank you for coming in person. And I promise I will come back and we can do a whole other one on the memory training. But for now, you should meet up with these two lovely ladies for their 4-week memory training course. Have a wonderful day and drive safely.
Thank you.
Yes, and for those at home, the recording, we did record this, so it should be available in a few days, and the slides and the memory workshop flyer will be emailed to
How many other people here?
Thank you so much.
It was great. You cracked me up with the Jafar thing. Because I was
I think
that's what my generation.
maybe 14 years.
Yeah, I was.